Well, hello everyone, and welcome to the fourth edition of TechScan's TekTalk series, Candid Conversations with Key Dental Influencers. Today we're talking with Dr. John Nosti. Dr. Nosti has received fellowship status in the Academy of General Dentistry, Academy of Comprehensive Aesthetics, and the International Congress of Oral Implantologists. He's the current Clinical Director of Education at Clinical Mastery Series and also faculty at the Mish Institute. He's a published author. He sits on editorial boards for dental journals and was most recently named in the top CE providers in dentistry, today's latest magazine, which I think has been for a number of years. But most importantly, he is a mentor to other dentists wanting to learn about comprehensive dentistry. So as someone that is actively involved in the dental community, Dr. Nosti is a great resource to learn about what's new in dentistry, and we are just very excited and grateful for his participation in this interview series. Before we begin, I'd just like to mention some information about Zoom webinar. If you experience any problems with audio, I recommend that you disable your audio and reconnect via your telephone line. This is being recorded and it'll be available shortly after the interview. We'll take questions at the end of the interview as well. So please submit these in the Q&A panel in Zoom webinar. So with all of that, welcome to all of you, and thank you for being here, John.
Thank you so much for having me, Jen. It's a pleasure.
Yeah, so today I figured we could focus on two main topics. Wanted to talk with you about comprehensive dentistry and also best business practices, as I know you are super passionate about both of those.
Absolutely.
So, yeah, so maybe to start us off, why don't you tell us a little bit about how you're doing, how's your practice been doing, and has anything changed for you, I guess, in the last 6 to 8 months?
So yeah, you know what? Honestly, awesome. This year has been really good. Despite even like the shutdown that we had in New Jersey for 3 months, prior to 2 weeks ago when I actually had COVID myself, and had to stay out of my practice for 2 weeks. Prior to that, my numbers were looking right on point to what I did last year. So
Wow.
yeah, it was pretty funny. I mean, I was looking at it like, wow, this year I had an unplanned 3 months off. Like, maybe how do I plan to have that much time off in the future and
Yeah.
still make as much money?
Yeah.
So that was one of the things. So we've still been busy. And I'll talk to you, as we go on as to why I think that is. So the practice has been going great. And we're looking to close out the year really strong with a number of rehab and veneer and implant cases coming up.
I saw you. Did you do one this morning? I saw you posted one this morning.
Yeah, I did it. I did a 10 over 10 this morning. So
nice.
It's
nice.
Yeah, it's great. It's awesome.
Good. So yeah, kind of jumping into the comprehensive dentistry stuff. So, we have a lot of dentists that ask us as a technology manufacturer, we often have a lot of doctors that are looking to do more comprehensive dentistry, right? They want to make that shift from drill and fill type dentistry to presenting more comprehensive treatment plans. But, that's often a big leap for them to do. So what are some of the skills that you recommend dentists need to learn in order to make that leap?
So, the first skill that I think someone really needs to have is, number one, you have to change your mindset. I know this might seem a little bit simplistic, but to me, I think this is the biggest barrier. So many people just have the idea that they can't build this comprehensive cosmetic reconstruction practice wherever it is that they practice. I'm sure people on here might be familiar with me, but maybe if you're unfamiliar with who I am and where I practice, what I tell everyone in a lecture is, your homework right now when we get done with this is to look up my zip code, and it is 08330. That's where I practice the majority of time, in Mays Landing, New Jersey. And what I want the participants who are listening to this to look up is, what is the median household income of where I practice? And then compare that to where you practice. And I would just about guarantee the median household income in your area is higher than where I am. In South Jersey, I am basically outside of Atlantic City by about a half hour. So in the last 5-6 years, the economy has tanked all of the casinos. So that, people have lost jobs. Unemployment in Atlantic County is super high. Taxes in New Jersey and cost of living is really high. Yet my practice, thankfully, continues to thrive and increase on a yearly basis. So first is get that mindset going. The next thing that you need to do is you got to get good at photography. You have to have a really good camera in your practice. And, I know you could do a lot of things with the cell phone, but I really do think you need to have like a DSLR camera in your practice,
Mhm.
not just an intraoral camera. Because when you do an intraoral camera and someone has like 10 areas that are a problem, it's much better getting one single occlusal photograph
Mhm.
versus 10 little areas, because 10 little areas make you think it's single tooth dentistry and you want to present it as a whole. So photography is really important. And, third, I would say is really understand how to do a comprehensive exam. This might seem really simple, but it's not just about teeth. It's about aesthetics. It's about the masticatory system with muscles and joints, and how everything comes together. So you really have to tie all of those things together. And the last thing is, really knowing how to communicate well with people.
Mhm.
And I think so many of us as dentists, we're just taught to always give people the answer. And, many times I find it better to ask a question versus giving an answer. And like a real quick example of that is, someone comes in, you present a plan to them, and, they say, how much is it? You give them a price. And, many times some people will be like, well, geez, I didn't think it was going to be that much. And, you know, from that, my response typically is, well, can you share with me what price did you have in mind? What
Mhm.
price did you think it was going to be? And you don't say that to be a jerk, but you say that. And the answer I get back all the time is, well, geez, I don't know.
Yeah.
So, when people say, oh, I didn't think it was going to be that much, but then they say, I don't know, then I think a good follow-up is, well, then how do you know I'm not the cheapest around, you know, versus
Right.
being a little too expensive. So it's just really getting to understand where patients are at. So I find asking questions is a better thing than just always giving an answer.
I think a lot of dentists also would jump to, in that scenario, would maybe jump as a patient says, well, I didn't realize it was going to be that. Oh, well, we can do cheap, we can do, you know, something cheaper. It's like you automatically assume that you have to do something cheaper, but it's like, no, this is, if you make it more conversational, right?
Absolutely. So rather than just going, we can make it cheaper, or going in and justifying your expense, I mean,
Yeah.
that kind of sounds bad, because then you're either going to talk up yourself, which now you sound a little egotistical, or you're going to
Right.
talk
Like,
up
oh, well,
other
we use
things like your
this and we
lab
do
that you
this. And
use. Yeah, I have the greatest technology in my practice, and other people don't have it.
yeah.
And the funniest thing was, I mean, this is honest to God true story. I had a gentleman refer to me because he had been rehabbed 2 times before, and each time it failed. So now he's referred to me for me to fix it. And here it is. I give him a fee, and his response was, well, I didn't pay that much the last time I had it done. And I literally took a step back, and my response wanted to be like, well, how's that working out for you?
I
It's so
know.
broken.
I was wondering if you
You
actually
referred
said
to
it.
me to fix it.
Yeah.
Right. And so then I said, well, can you share with me, how long has it been since the last time you had it done? And he said, well, it's been 5 years. And I said, well, I think it's unfair comparing my price this year
Yeah.
to that person's price 5 years ago. You didn't ask me what I would charge you 5 years ago. And
Right.
that was the only thing I had to say to the patient. And he said, rather than going back and forth at that point in time, it's like, when can we start?
Right.
So it really is just coming up with a good question versus, always just answering back and justifying things.
Yeah. I like those recommendations for people because I do think, again, that jump from, drill and fill to more comprehensive treatment. And I think we hear this a lot too is, mindset, photography being key. And then what was the third thing that you had said? Oh, answering a question with a question, essentially, right? Improving
Yeah.
your
Yeah.
communication.
There's
Improving
actually,
your communication.
and moving, yeah, improving communication, and then obviously knowing how to do a comprehensive exam.
Yeah,
A really good systematic way to do it.
totally.
Those are key.
Cool. So if a patient comes into your practice and they're not specifically seeking out cosmetic treatment, because do most of your patients, do they come in and seek out cosmetic treatment? but you're in a situation where you notice significant breakdown, and tell us a little bit about what you talk with them about, and what is your process for getting them to understand their problems and then see value in a solution.
Jen, I think that's a great question, and even how I built myself as a cosmetic dentist was, I was really one of the first guys in the area to have a website and to have this big photo gallery. So we had that there, and those are static things. And it's so funny, like I'm so dating myself when I say the first in the area to have a website. Going back in 1999, 2000, people didn't have that stuff.
Yeah, totally.
So we did that. We had photos to put on, but then, hands down, at least 4 or 5 to 1 was the functional cases that I did, because there was, as you said, breakdown and everything else, versus the person who came in saying I wanted it. So easily 4 to 5 to 1 was the discrepancy. Now, when you go to my website and I have 150 before and afters, and obviously we push and we market for that. Yes, there are more people who come in now than 20 years ago wanting a smile, but it still is on a yearly basis. I do more dentistry because of functional reasons than for cosmetic reasons. So, and I think that's really what a key part is, regardless of what the person's coming in for. Yeah, we do screen people a little bit ahead of time in order to understand where they're at and to understand what language they speak. Are they someone who is cosmetically motivated, or are they someone who wants to prevent problems? So if you're cosmetically motivated, you're going to talk about excitement and cosmetics. If it's someone who wants to prevent problems, well, then you're doing a full exam, and then you're talking about where breakdown and how do you fix those things. Protection, all those things.
Issues in the future.
Absolutely. Right. But still, when you look at it from a systematic standpoint, the person comes in, both those people get photographs, both those people get a full mouth series of x-rays, both of those get a joint exam and an occlusal exam, but it's what you then do with that information. So it's the same system. This person, I might just talk about their photo, like their smile and their headshot, because they're cosmetically motivated, where this person, 9 times out of 10, it's going to be a retracted out of occlusion picture showing all the wear, and then upper and lower occlusals, and showing, all the chocolate that's showing on their teeth. Right. That's always how my process goes, 9 times out of 10.
And do you find that people really find value in that? Like, how do you move from then that to then the next step of getting them like further in the process?
So, I always hear people who are just like, wow, no one ever talked to me about this. My previous dentist told me I was grinding, but they really didn't say what I need to do about it and how do I fix it. And whoa. And then, from there, it's a matter of, just getting them into the right channel. So if that person now is like, wow, I really need to do something about this, I'm ready to go. Obviously, they're going to go through now diagnostic records and plan and, financials, and then they're going to get treated. Some people, they're a slow touch. And what I mean by that, they still recognize and they understand what I've told them. But maybe that person is going to get a night guard and some single tooth dentistry until they're ready to pull the trigger. But they know anything that we do for them, it's a Band-Aid. It's a Band-Aid on a problem until they're ready to fix it. And your goal at that point in time is to really keep that person in the practice. And, I do offer, chances and reconstructions for them to stage their treatment. We can start with everything in composite and then trade it out from composite to porcelain as time goes on. And it's really funny, when I talk to patients about that, it's like, yeah, you know what? I know you've asked me how much this is going to cost. And I know a lot of times their second question is, how much is my insurance company going to cover?
Yeah.
And I give them a fee to restore them in composite, but I'll say, the benefit is when we change this over to porcelain, your insurance company is going to cover half of your treatment.
Right.
And they're like, wow, that's great. And I'm like, yeah, it's only going to take about 20 years to complete your rehab.
Yeah.
$1,000 a year,
Right.
£1 a year, 20 years. And they're
Yeah.
like, and it's so funny. Patients at that point, they're going to go like, you're kidding me, 20 years? I'm like, yes,
Right.
great. They're going to cover half. And they're like, so patients start coming up with like, well, what would it cost if I finish it in 10? Or how about in
Right.
5? Or
Right.
if I move money around, how about you do the upper this year and lower next year? So they start going from setting parameters of what time and expense, and they start choosing to shorten it
Right.
based on being able to stage the treatment.
There's so much misinformation out there about dental insurance. That could be like a whole other 2-hour webinar series here.
Absolutely.
um,
Yeah, you could talk forever on that.
Yeah, exactly. So we know that there's certain clinical skills and communication skills that are needed as an office wants to shift to do more comprehensive dentistry. Are there certain technologies that an office needs? And I'm not just trying to give you, I'm not trying to give you an opportunity to plug T-Scan. We know that, we know that you're an avid user of T-Scan. It's more so, do they need to make significant changes to their practice? And what are your recommendations, I guess, for getting them started?
So I think the really cool thing about doing comprehensive dentistry is you can start adding things as you go along.
Mm-hmm.
So, obviously one of the first things is I definitely think you need a camera. It's not a huge expense. That's almost a must. The next thing, and I'm sure many dentists have this now, are electric handpieces. I mean, if you have an air-driven handpiece, do yourself a favor tomorrow, get quotes on electric. It'll change your life.
Right.
And I think once you're doing, a few cases, I definitely think, T-Scan is probably one of the bigger technologies I think people should invest in earlier on who are doing comprehensive ceramic and implant dentistry, especially doctors who are doing, a whole arch, all on 4, all on 6. I'll just call it an all on X.
Yeah.
If you're doing an all on X treatment, and especially if you're doing immediate load, I mean, you need a T-scan. I mean, it's an absolute must. It's going to repay itself in dividends in preventing fractures and failures of your dentistry, hands down. And then, once you really have a good control of these things, I mean, I think, obviously a laser is something that works out really well, and they can be really inexpensive with like Picasso, and something like joint vibration analysis to check joint health. I think it works really well because now, your assistants are doing that as part of your new patient exam, as well as my assistants do my photos and my T-scan. And then I come in and then I present all of the findings. So
right, it doesn't take away from your chair time at all.
Not at all. So you're doing like this really thorough exam, and the patient is in the office for like an hour, hour and a half, but they're really only occupying about a half hour of my time, and really an hour of my assistant's time. So that's how we get all those things done.
I think that's good advice. I mean, we find that too, we're often talking with doctors, and a lot of our team at TekScan has been with TekScan for a really long time. And so we wind up consulting with dentists all the time about, well, what do I need? And, surprisingly, T-scan is not always the first thing out of our mind. It's like, you need to learn, and I know we'll touch on, the courses at Clinical Mastery Series and MISH. And, I think that it's, you need to learn the skills, right? And then you need to have a couple core technologies. And certainly once you're doing the cases, or if you want to use T-scan to help educate your patient on some of their occlusal discrepancies or problems, then that's when that technology becomes, really important, I think.
Yeah, absolutely. I mean, you definitely have to be doing some cases in order to have it being utilized. But even if you're doing a lot of dentures, I mean, that's going to save your life.
No, absolutely. Absolutely. So let's talk a little bit about T-scan. Don't want to spend too much time on it. But, for you in your practice, what's the main, you've been using T-scan for a long time. You and I have worked together for a long time. What's the main value to you in your practice that T-scan brings?
To me, it really is about measuring force and time. You can sit there with articulating paper and look at all the dots that you want. And, time and time again, I know you know this, big dot, small dot, no dot. It doesn't mean anything, and when you're doing a lot of all ceramic dentistry with, glazed ceramics, it gets hard to get an arch, and get teeth to mark.
Mhm.
So, to me, looking at it and practicing with it for, I think it's 16 years now, you know, thankfully my remake rate with my lab is extremely low. My
Mhm.
fracture rate is extremely low. And I know the reason for that is because I'm able to measure the force that patients are putting on their dentistry.
Mhm.
So, I look at it in terms of, for the average general dentist, being able to do that alone is going to do tons of time
Yeah.
on dentures, being able to reduce the amount of adjustments post insertion. I mean, I can tell stories about how many patients come in with a bag of dentures and they all say the same thing. I can put them in, I can take them out and they're fine. It's when I go to start chewing is that, the wheels fall off the wagon.
Mhm.
And, I've had one patient in my life, in my career, who I could not occlusally fix their dentures because they were so bad. I had to
Mm.
make them a new set. But everyone else comes in, we equilibrate them, we center the force trajectory through the hard palate, and
Yeah.
they're good to go. So, and even with implant pros, I mean, patients have no proprioception. So they can't even tell you, like, even, yeah, I think this
Right. You
one
say, how
feels
does it
high,
feel?
you know?
Right. Yeah.
Yeah, that's one of the first things you understand. You lose that saying, once you have a T scan, because you can ask the person, how does that feel? And the patient says, it feels great. And you look at the T scan, you're like,
Yeah.
yeah, no, it's not.
We
Let
might be
me do
another
more
minute or
adjustment.
two. Yeah.
Yeah, it might be another minute or two. And always, and even those patients who might tell you they feel great, once you fix them occlusally, they sit up and then they go, well, how does it feel now? And all the time they go, wow,
Yeah.
wow. And
Yeah.
like, that's the word that I hear all the time. So dentures, implants, it's all the same thing. So being able to measure force, and then for people who deal with orofacial pain, being able to measure time and, being able to reduce the amount of time it takes for that person to get into anterior guidance,
Mhm.
that's key for those patients as well, especially
Absolutely.
daytime bruxers, so it's super key.
Cool. Well, that's good to hear. That's great. Great advice too, I think, for folks that are online. All right, we're going to shift a little bit to business things. So, you're big, you own obviously your own practice, but you also own a business, maybe more than one on the side. And what are two or three things that you've learned over the years about owning your own business that you can relate to people that are online?
Absolutely. Number one, even involved in dentistry, I think one of the first big things is, you have to have a team that shares your vision.
Mm-hmm.
So no matter what business you have, if you have employees that are not on the same page as you,
Mm-hmm.
the old analogy, if they're not riding the bus with you, get them off the bus and get, employees that are seeing your same vision. Likewise, I know so many dentists, they go out and they take all this training, but they never train their team.
Mm-hmm.
So, getting your team trained at the same vision that you're seeing and your goal and what you want to do. I mean, there's a lot to be said about being able to do that. So
Totally.
team, I think, is huge. Um, you know, Obviously investing in yourself and your education is tremendously important. Not that you have to take every continuing education seminar out there, but if you want to be a leader in whatever field that you want to be, implants, cosmetic dentistry, reconstructions, whatever it is, you do have to be well educated in that field. And a really important thing that so many people nowadays just aren't doing is you need to have a really good marketing plan.
Mm-hmm.
You know, that is one of the reasons why I can say that, my office has done so well. It's no longer just about having a website. Sure, 20 years ago, I joked around earlier, 20 years ago, having a website
That worked.
and paying someone for SEO, that worked.
Mhm.
Nowadays, everybody has a website. If you don't have a website, you're back in the Stone
That's
Ages.
the first thing I look for when I'm looking
Oh,
at, I mean, everybody does this, and I'm older compared to everybody else. It's crazy.
yeah. I mean, that's the first thing you look at. I mean, you need to have a website. You need to have reviews for your website, but you need to have a marketing plan.
Uh-huh.
That's really important. And it's not always just about paying for SEO and trying to get your page to the top of the list. That's no longer valid. It's literally having a plan to drive patients to your website. So whether or not it's direct mail, whether or not it's magazines, my office, we put together a magazine through a company, and that gets sent out, to people's houses. And of all places, it's in Wawa shops. So for those of you around the country and other states, it's literally Wawa, I guess would be compared to like a 7-Eleven, a Starbucks if they had a gas station.
Yeah, local convenience
store, gas station combo that everybody walks in the morning, everybody gets their coffee, like right out in the front, there's magazine racks and my magazine is on there. And it sounds so funny, but most of my comprehensive cases coming in, how'd you hear about us? Oh, I've been seeing your magazine, or I've been getting the South Jersey Dentist magazine for years, and it's amazing. Your office is always on the cover. So,
right.
True story.
That
so
was planned that way.
Yeah, I mean, it's expensive, but really, it's one comprehensive case. Pays for a whole year of that.
Totally.
So, and so many people just look at the price tag and they're like, I'm not going to pay for that. But, there's a reason why my office can produce even with 3.5 months off, marketing plan, driving people in.
I think too, that marketing plan needs to be like specific to your office. Like it has to be more of a personal touch too, in some way. I think people are so much more emotionally driven to buy things now, than ever before. So.
Absolutely. Great photography, and emotionally driving photography, definitely helps out. It's so funny. Like when we shot photos for the magazine, the company came in, and it's literally like other dentists around the country use the same company, and all the photos are very similar. Like there's a patient in the chair and my assistant's putting a blanket over the patient, and they're both looking at each other and smiling.
Yeah.
But people see that and it just feels like, wow, these people feel really friendly.
Yeah, totally.
Like a really
so different
place. Yeah. So, I mean, all
like
the
my dentist doesn't do that.
Yeah. It's amazing how well that works.
Cool. Well, we appreciate all of your insight today, the two different topics here, comprehensive dentistry, and then, some business topics. Let me take a couple questions from the audience. Just give me a second.
Sure.
Well, and this is good because we wanted to touch on this too. So the first question that I have here is, what's happening with the courses that you are involved in? We know that people have got to learn the skills, right? And you're involved with Clinical Mastery Series, you're involved with MISH. Let's talk about those a little bit. Let us know what's going on with them. Are you guys doing live or virtual? And how do they learn more about the course opportunities that you're involved in?
Yeah. So, I mean, oh, what the heck happened?
You still there? I can hear you.
Am I still here?
Yeah.
Okay. Sorry.
That's okay.
All of a sudden, like my computer just glitched. I'm like, wait a minute.
Oh, no, you're good.
I'm glad I didn't curse. I was ready to start dropping F-bombs. Okay. So, all right, back to the story. So, we are starting back live, come January. The Clinical Mastery Series, we're offering all of our occlusion series and all of our courses live again, starting, January, I think the second or third week in January.
Okay, great.
So people can go to the website at clinicalmastery.com and check out those dates. For the people who are still a little bit afraid to travel, we do have courses online. And that website is online.clinicalmastery.com. And we do have our Occlusion 1 and Occlusion 2 course online,
Cool.
as well as our anterior aesthetics course and a couple other little, tidbits of information that they can see on there, like small, like 1 hour, 2 hour things. But I think what's really important that everybody understands is, at all of our clinical mastery courses, every course is hands-on. It's not just lecture. So when you go to the online component, you're only getting the lecture portion of it and you're missing the online.
Yeah.
So, I mean, you're missing the hands-on. So for example, like in our Occlusion 1 course, I mean, that kind of gets you to understand how to do comprehensive dentistry. We show you how to do a comprehensive exam. We show you what records to take, and you're doing all of that hands-on. Even how to do a trial equilibration, that's hands-on. So, you miss all of that portion of it. You get the lecture, but you don't get, to do it with a participant and having a faculty member with you, making sure that everything is done the right way.
Right.
So, I mean, you have goods and bads. I mean, the benefit is you could do it from the comfort of your own home. The negative is that you're missing the hands-on portion of it.
Right.
But we do have that. The Mish Institute, where, I'm involved as a prosthetic faculty member, even for surgical courses, those are still going live, today. I know there's really nothing at the end of the year because it's December, but starting January, the series is starting over again. And, you have the option of taking it in either Orlando or I think Dallas, Texas. So those are two typical locations that you can run the whole series.
Okay. Awesome. That's great to know. And when we, when we send out this recorded version of the webinar, we'll make sure that those links are in there so people can just have direct access to that. So
awesome.
If there was any questions on that, we'll make sure that gets communicated. Next question here is, when do you choose to do digital dentistry versus traditional?
So if the question is like involving like a scanner, like that. So, there are still certain things that I like traditional impressions for. Like number one, a lot of my reconstructions, when you look at it, the patient has already prepped their teeth. They already ground them down, or they had acid erosion, whatever it may be. And a lot of those patients, I don't have to break contact on their teeth, because now we're just adding things vertically and facially, and maybe a little bit lingually. I found that those are situations that really are not good for a scanner. You don't break contact. It's hard. It's really hard to scan and have a lab read that well. So that's where I'm still doing traditional impressions. Single tooth dentistry, Invisalign, even a bridge. Those are great things for a scanner, but I still find when I'm doing large cases, for several reasons, I'm still doing impressions on them.
Yeah. Sounds good. And I think the thing that sometimes people aren't aware of is that, once the case comes in, regardless of the way in which the impression was taken, on the lab side of things, 98% is getting transitioned over to digital anyway.
Right.
So as long as it's accurate on the front end and you get the most accurate, record that you can possibly get, that impression is key, right? Once the lab gets it, they're going to do all sorts of digital stuff with it anyways.
Absolutely.
Yeah, totally. Okay, cool. So there was another question here. So somebody had asked for questions on, I have a T-scan, but need a refresher on interpreting the data. So that was an anonymous question. I'm just gonna refer them to the, because they registered for this, they actually have access to 4 workshops. That's probably the best place to start. And then please reach out and contact us. We have a number of training resources and options for them to, learn more about interpreting the data. Somebody wanted you to talk a little bit about your fees specific to T-scan, actually. So I don't know if you want to just touch on that.
Yeah, that's a great question. So I think most importantly, I would look at what are they charging per fee, or I should say per unit, for a comprehensive case.
Mhm.
So early on in my career, we had, and we still do, we have like a single unit crown fee, but if it's part of a comprehensive case, that number gets bumped up, typically by $500. So what I would say is early on, if you're not happy with the amount of money that you're getting paid per unit for those big cases, and you're trying to be, I guess, competitive to people in your area, and you're keeping your per unit fee lower, my suggestion is to do what I did early on. And anytime I did a comprehensive case, I would add a $1,500 fee to it. And it was for complex occlusal equilibration is the code that I would use. And that would be in order to T-scan the person. Now, typically, if it's someone who, like, even if I did a 10 unit case on them, I would T-scan them the day that I inserted it. And then typically I'd bring them back one more time for like a half hour visit. And that was, it's kind of funny. That was a visit for me to say, hey, I'm just going to double check your bite, make sure everything is perfect.
Right.
But I'm also going to take your photographs that day. So the person saw value in coming back and having me make sure their bite was perfect. And that was also a way for me to get them back in to make sure I had post-op photos when their gum tissue was healthy and everything looked great.
Totally.
And so that was the fee covered those two visits. But if you looked at it, I was adding a $1,500 charge to all my comprehensive cases.
Okay.
Nowadays, I don't charge that fee separate of my cases. I've bumped up the amount of units that I charge. Now I tell patients that, hey, this is one of the things that separates me from other people. And this technology is something that I'm going to use to make sure that your bite is perfect and the forces on your ceramic are great.
Yeah.
Because then I go into all the issues that without doing that, it could be a problem. So now when patients are jumping around from dentist to dentist and getting prices, they realize what I do different.
Right. Right. Yeah. I think that makes sense.
Yeah. But if I'm doing an occlusal equilibration on someone, I'm doing like a disclusion time reduction, that's a $1,500 fee and typically a 2 or 3 visit, process.
Okay, cool. I think that's good to know. I think that's all that we'll have time for now. There's a couple more questions, but I think what we'll do is we will answer those individually with people as well. I just want to thank you so much for your time and sharing your passions with us. Just really appreciate you taking some time.
Yeah, Jen, thanks so much for having me. It's always an honor, to be involved and do anything with T-Scan. I appreciate it.
Awesome. So just for the audience, although we did touch a bit on T-Scan during the interview, the 4 workshops that I mentioned, they're available to the audience for free and they can be accessed with your enrollment into the series. So if any questions came up during the interview or the workshops that you watch, please contact us directly. You can reach us at 617-464-4500. Again, that's 617-464-4500, or at info@tekscan.com, which is TEKSCAN.com. To everybody watching, have a good day or night. I guess it depends where everybody is. We have a worldwide audience, and please join us as we continue with our TekTalk series. So thanks again, John.
Thank you so much, Jen. Have a great day.